The motor activity log is a patient-reported outcome that assesses arm function. It is used to determine how well the participant uses their more affected arm outside of a lab or clinic setting. It is used to assess individuals who are recovering from a stroke. The motor activity log takes about 25 to 30 minutes to administer and only requires the survey instruments and a pencil. In this assessment, an individual is presented with standardized questions to rate quality of movement and amount of movement during daily functional tasks. Two types of scales are used by the individual to rate each functional task. The amount scale is used to determine how often the individual is moving his or her arm. The how well scale is used to determine how well they are moving their arm or the quality of the movement. The scales each score from a 0 to a 5, but the administrator must inform the participant that they can rate half scores. For example, a 3.5 if he or she feels that it best accurately describes their situation. There are specific instructions to follow to administer the test depending on the time frame that the test is being administered. First, the instructions and the differences between the rating scales are explained. It is important to stress that the questions they will receive are for what they actually do and not for what they think they can do. The participant is given the two scales, each on a separate piece of paper to view, while the administrator asks them questions. It is important to note that the amount scale should be given before the how well scale. After the participant answers with the correct response, the administrator then verifies and probes responses. The caregiver and/or significant other is given the motor activity log in the end, but without the client in the room. These are the instructions that are read to the client at the beginning of the assessment. I will now demonstrate an example of the test and how it would be administered. It is important to note that the administrator is given a script to follow depending on the responses of the client.
So considering your activities during the past week, did you use your weaker arm to turn on a light with a light switch?
Yes.
Okay, so now looking at this scale, using the amount rating scale, tell me how you would rate the amount you used your weaker arm to turn on a light with a light switch.
I would say a 1.
A 1? Okay. So you believe that you occasionally used your weaker arm, but only very rarely to turn on a light with a light switch.
Yep.
Okay. Now, considering your activities during the past week, did you use your weaker arm to put on your socks?
No.
No? Okay. Now, using this possible reasons, are any of them match why you would not put on your socks with your affected arm?
I would say reason B.
Reason B? Okay. So you're saying you did not use your weaker arm to put on your socks as someone else did it for you?
Yep.
Okay. Considering your activities during the past week, did you use your weaker arm to open a drawer?
Yes.
Yes? Okay. So now using the amount rating scale, tell me how you would rate the amount you used your weaker arm to open a drawer.
I would say a 2.
A 2. So you believe that you sometimes use your weaker arm, but did the activity most of the time with your stronger arm?
Yep.
Okay. Okay, so now we're going to go on to how well you do an activity with your weaker arm.
Okay.
So remember that I'm asking you to rate something different on this scale, the how well scale, than you did before on the amount scale. Before, you were supposed to rate how much you used your more affected arm. Now, I would like you to rate how well you used your more affected arm, if you did use it. For example, you might have used your more affected hand to pick up a glass and drink only rarely. The amount rating might be a 1.5 or a 2. However, when you did use it, your use of the hand was really quite good. Let us say between fair and almost normal, a 3.5. Is the difference between the two types of ratings I'm asking you to make clear?
Yes.
Okay, perfect. Okay. Considering your activities during the past week, did you use your weaker arm to pick up a glass, bottle, drinking cup, or can? This does not need to include drinking.
Yes.
Okay. So now, using the how well scale, tell me how you would rate how well you used your weaker arm to pick up a glass, bottle, drinking cup, or can.
I would say a 2.
A 2? Okay. Now, considering your activities during the past week, did you use your weaker arm to use a fork or spoon for eating?
Yes.
So now using the how well rating scale, tell me how you would rate how well you used your weaker arm to use a fork or spoon for eating.
I would say between a 2 and a 3.
Okay, so you would say you use it somewhere between poor and fair.
Yep, so a 2.5.
Okay. Now, considering your activities during the past week, did you use your weaker arm to brush your teeth?
No.
No? Okay, so now using the list of reasons, do any of them match why you would not use your weaker arm?
I would say reason E, because I'm
Reason E?
right-handed.
Okay, so you would say it's an activity that you normally do with your dominant hand.
These are the tasks that the motor activity log assesses. These are the scales that are presented to the client during the assessment. This is the data that has been presented through different research studies. Overall, it is a reliable and valid outcome measure that assesses an individual's more affected arm use outside of a laboratory setting. Interestingly, one study concluded that the quality of movement scale, or the How Well scale, captures how well and how much the patients used their more affected arm to accomplish ADLs. They concluded that the motor activity log amount of use scale was highly correlated with the quality movement scale, so it might be dropped. Because the motor activity log is a self-reported measure, it is relying on information given by the individual and therefore might not always be accurate. According to research, some items were not applicable due to cultural or gender differences. Some of these included using a fork or spoon for eating, combing one's hair, or putting on makeup and shaving cream on one's face. Furthermore, verifying and probing the responses from the patients did not tend to adjust the scores. Probing a response occurs when the test is being administered to a client and there is a change in scores from the very first administration time. When this happens, the administrator asks the client why they think there is a change and if it represents a real change. Depending on the response of the client, this could make them change the score that they gave for that task. So it is interesting that research determined that this does not bias the scores. These are my references. Thanks for watching!